What if the one thing your doctor never told you is silently destroying your body right now? Every single day you choose to ignore it? What if I told you that the simple, natural act of ejaculation, something most older men either stop doing, feel ashamed about, or completely neglect, is actually one of the most powerful biological protection mechanisms your body has ever been given? What if the reason so many men over 50 are suffering from unexplained prostate pain, hormonal crashes, chronic fatigue, and emotional numbness is not their age, but their silence? What if your body has been sending you warning signals for years, and you have been mistaking those signals for just getting older? Here is the shocking truth that urologists around the world are now openly discussing. And what you are about to hear in this video might completely change the way you understand your own body, your health, and your future. Stay with me, because what comes next is not just surprising. It is something every man over 40 absolutely needs to hear before it is too late. What if the most dangerous thing a man over 50 can do for his health has nothing to do with smoking, nothing to do with poor diet, and nothing to do with lack of exercise? What if the most dangerous thing an older man can do is simply stop ejaculating and never talk about it? Today, we are going to have an honest, medically grounded, deeply important conversation that most people are too embarrassed to start, but that every single older man desperately needs to hear. Let us begin with something that will immediately shock you. The prostate gland in the male body is not just a passive organ sitting quietly inside you doing nothing. It is one of the most active, most sensitive, and most metabolically demanding glands in the entire male anatomy. Every single day, your prostate is producing fluid, filtering substances, managing hormonal signals, and participating in processes that directly affect your urinary function, your immune response, and your overall internal chemistry. And here's what nobody is telling older men clearly enough. When the prostate is not regularly flushed through ejaculation, it begins to accumulate. It begins to hold. It begins to stagnate. And stagnation inside a biological system is never a good thing. Think of it exactly like a pipe in your home. When water flows through it regularly, it stays clean, functional, and open. But when that same pipe sits unused for weeks, months, years, it corrodes from the inside. It builds up mineral deposits. It narrows. And eventually, it fails completely. Your prostate operates under almost the exact same principle. The fluid that accumulates inside the prostate when ejaculation does not occur regularly becomes a breeding ground for bacteria, for dead cellular material, for inflammatory compounds, and for substances that research has increasingly associated with the early development of prostate cancer. This is not a theory. This is not speculation. This is documented, peer-reviewed, scientifically supported biology. And yet most older men have never once been told this by any doctor in any clinic. Now let us talk about numbers, because numbers have a way of making things real. A landmark study published in a major urology journal followed thousands of men over multiple decades and tracked their ejaculation frequency against their prostate cancer diagnosis rates. The results were extraordinary. Men who ejaculated 21 or more times per month, roughly once every day or every other day, had a statistically significant reduction in their lifetime risk of developing prostate cancer compared to men who ejaculated only 4 to 7 times per month. 21 times per month versus 4 to 7 times per month. And the difference in cancer risk was not small. It was dramatic. It was the kind of difference that, if it were produced by a pharmaceutical drug, that drug would be considered one of the greatest medical breakthroughs in modern history. But because it involves a natural biological function that society has wrapped in shame, embarrassment, and silence, especially for older men, almost nobody is talking about it at the population level. Almost nobody is sitting an older man down and saying, "Sir, your sexual health is your physical health, and neglecting one is directly destroying the other." And this brings us to something that goes far deeper than just the prostate. When an older man stops ejaculating, whether because of a reduced relationship, personal shame, the false belief that sexual desire in older age is somehow inappropriate, or simply because he has accepted numbness as a normal part of aging, something begins to happen hormonally that is profound, widespread, and devastating. Testosterone, the primary male sex hormone, is not just about sexual desire. Testosterone is involved in muscle maintenance, bone density, cognitive sharpness, emotional regulation, cardiovascular function, metabolic rate, immune system strength, and your fundamental sense of self-worth and vitality. And when ejaculation stops occurring regularly in older men, testosterone levels do not stay stable. They begin to fall. Not dramatically overnight, but quietly, gradually, consistently, like air slowly leaking from a tire. And as testosterone drops, cortisol, the stress hormone, begins to fill the vacuum. The result is an older man who feels chronically tired for no clear reason, who struggles with motivation, who experiences low mood or even depression without understanding why, who finds that his body is gaining fat and losing muscle even though his diet has not significantly changed, and who simply feels like he is fading, like something essential inside him is slowly going dark. And here is the heartbreaking part. Most of these men are told by their doctors that this is simply aging. They are told this is normal. They are given no deeper investigation. They are sent home with perhaps a prescription for fatigue or mood support or blood pressure medication, when the actual root conversation that needed to happen was never initiated at all. Because the conversation that needed to happen was this: are you still sexually active? Are you ejaculating regularly? Is your body receiving the hormonal and physiological signals it needs to continue functioning at a baseline level of health? These are not inappropriate questions. These are medically essential questions, and the absence of these questions in routine clinical care for older men represents one of the most significant gaps in preventive medicine that exists today. Now let us address the cardiovascular dimension, because this is where things become even more urgent. The male cardiovascular system and the male sexual system are not separate. They are profoundly, intimately connected. The ability to achieve and sustain arousal is directly dependent on healthy blood vessel function, healthy arterial walls, healthy blood pressure, and healthy circulation throughout the body. And what researchers have found, and this is something that should be shouted from every health platform in the world, is that the relationship between sexual activity and cardiovascular health flows in both directions. Meaning, poor cardiovascular health damages sexual function. But also, the cessation of regular sexual activity and ejaculation appears to contribute to cardiovascular deterioration. Men over 50 who maintain regular sexual activity, including regular ejaculation, consistently show better blood pressure profiles, lower rates of heart attack, better arterial elasticity, and stronger overall cardiovascular biomarkers compared to men of the same age who are sexually inactive. Sexual activity is, quite literally, a form of cardiovascular exercise that also triggers hormonal cascades, neurotransmitter releases, and immune system activations that protect the heart. When an older man stops ejaculating, he is not just losing a pleasurable experience. He is removing a protective biological mechanism from his cardiovascular system at precisely the age when his cardiovascular system needs the most protection it can get. And then there is the neurological component, which is perhaps the most underappreciated dimension of all. Ejaculation triggers the release of oxytocin, dopamine, serotonin, endorphins, and a cascade of neuroprotective compounds that have measurable effects on brain health. Oxytocin reduces anxiety and stress. Dopamine reinforces motivation, learning, and emotional reward. Serotonin stabilizes mood. Endorphins are the body's natural pain management system. And together, these neurochemicals, released consistently through regular sexual activity, contribute to cognitive sharpness, emotional resilience, sleep quality, and a measurable reduction in the biological markers of brain aging. Studies have begun linking sexual inactivity in older adults to accelerated cognitive decline. Not because the sexual act itself is what protects the brain, but because the hormonal, neurochemical, and cardiovascular environment created by regular sexual activity is fundamentally brain protective. An older man who stops ejaculating is, without realizing it, withdrawing a source of neurochemical nourishment from his brain at the exact age when his brain's defenses are already beginning to thin. Now, I want to speak directly to the cultural dimension of this issue, because it is impossible to have this conversation honestly without addressing it. In many cultures, many communities, and many families, particularly among older generations, male sexuality after a certain age is treated as something that should quietly disappear. Older men are implicitly and sometimes explicitly told that sexual desire in their 60s, 70s, and beyond is somehow undignified, inappropriate, or embarrassing. They internalize this message. They suppress their natural biological impulses. They stay silent about their bodies. and then they suffer. Not loudly, not dramatically, but quietly, privately, in ways that slowly erode their health, their vitality, their mood, and their sense of self. And they never connect this suffering to the silence they were taught to maintain. This silence is not dignity. This silence is not dignity. This silence is not cultural virtue. This silence is, from a purely medical and biological standpoint, harmful, and it needs to end. Every older man deserves to know that his sexual health is his health, completely, totally, and without qualification. Every older man deserves to have a doctor who asks the right questions and provides the right information. Every older man deserves to understand that maintaining sexual activity, including regular ejaculation, well into older age, is not indulgence. It is medicine. It is prevention. It is self-care at the most fundamental biological level. If you are an older man watching this, and you have been suppressing, ignoring, or feeling ashamed of your sexual health, I want you to hear this clearly. Your body is not wrong. Your desires are not inappropriate. Your needs are not embarrassing. Your prostate needs flushing. Your hormones need stimulation. Your cardiovascular system needs activation. Your brain needs nourishment. And your body has been designed with a mechanism to provide all of these things. A mechanism that research consistently shows you should be using regularly, unapologetically, and without shame. If you are a partner, a family member, or a friend of an older man, understand that his sexual health is your concern too. Not because it is your business in an intrusive sense, but because the man you love may be silently suffering from something that nobody has given him permission to address. Give him that permission. Have the conversation. Remove the shame from the room. And if you are a healthcare provider who has never thought to ask an older male patient about his ejaculation frequency, consider adding that question to your intake. Consider that the answer to that single question might open a door to a conversation that prevents prostate disease, improves hormonal balance, protects cardiovascular function, and genuinely extends both the length and quality of that patient's life. The body does not care about cultural discomfort. The body does not understand shame. The body only knows biology. And biologically, the message is unmistakably clear. Regular ejaculation in older men is protective, essential, and deeply important. And the consequences of its absence are real, measurable, and serious. What if the conversation you were afraid to have was the one that could have saved your life? The truth we have explored today is simultaneously simple and profound. The male body at every age, including well into older adulthood, is designed for regular sexual function, and that function serves purposes that go far beyond pleasure. It serves the prostate. It serves the hormonal system. It serves the cardiovascular system. It serves the brain. It serves the immune system. And it serves the fundamental psychological and emotional well-being of a man who deserves to feel fully alive, fully healthy, and fully himself at every stage of his life. The greatest gift you can give yourself as an older man is not silence. It is not suppression. It is not compliance with a cultural script that was never written with your health in mind. The greatest gift you can give yourself is knowledge, honesty, and the courage to take care of your body the way your body was designed to be taken care of, completely, unapologetically, and with the full understanding that your health matters, your body matters, and you matter. Do not wait for symptoms to force the conversation. Have the conversation now. Speak to your doctor. Listen to your body. And never, never let shame stand between you and the health you deserve.